Is your organization taking the best possible approach to risk coding? If not, you're setting yourself up for serious financial loss. When it comes to risk code collection, a systematic approach leveraging the expertise of your clinician workforce is absolutely essential. Many organizations are turning to third-party software to extract risk codes from their electronic medical records using artificial intelligence. Such products are certainly shiny, but they're also very much still a work in progress, requiring your large upfront capital expenditures and ongoing licensing fees to support their development. With constant hardware upgrades and compatibility issues, they function more as a center of cost rather than a center of revenue. If grafted on a poorly performing system, that system will simply continue to perform more poorly, just at greater expense. Other organizations are relying on the innate features of their in-house electronic record to badger already underperforming clinicians into spending even more time on documentation with little personal financial benefit, and unsurprisingly, mediocre results. Fortunately, over the past 2 decades, I've developed a foolproof system that enables any care delivery organization to streamline and perfect the process of risk code identification, documentation, and submission, without expensive ongoing capital expenditures or morale-crushing provider workflows. My risk coding system consists of 3 key parts. The first part is identification. This is all about identifying patients and getting them in for their routine assessments. You must get 95% or more of your patients in for a visit every calendar year. In fact, this should be recognized as the primary core metric at your organization. The key to achieving this metric is to build strong relationships between patients and their own personal clinicians. Only their clinicians' influence will serve to get the most recalcitrant patients in to be seen, and getting those patients in will make the difference between your overall profitability or loss. Once you get them in, you must use a systematic workflow adapted to your specific contract to address medical problems and capture every appropriate risk code. Soon the government will change the requirements to visits every 2 years, making it even easier to miss your hard-to-find patients unless you approach this metric systematically as an absolute priority. The second is documentation. It's not enough to simply identify the conditions that are associated with increased risk payments. You must make sure that they're recorded in compliance with ever-changing and often arcane documentation requirements. Your clinicians must be effectively trained to address and document both the most common risk codes and the uncommon ones that mean the difference between a system with average performance and one which excels. A simple video or laminated card just won't cut it. Experience teaches that only direct mentorship produces the best results. Risk coding is complex and time-consuming, so aligned incentives between your organization and your clinicians is essential for your success. And ongoing education and quality review is an absolute must. The third and final piece of the puzzle is submission. There's simply no skimping out on this part of the process. You must have a certified risk coder to vet your documentation before submission. Your risk coder can be in-house or, for practices of fewer than 4 clinicians, contracted out. If you have an even smaller practice, then consider getting certified as a risk coder yourself. It only takes 12 hours and is worth every minute. By having a risk coder review your documentation and provide regular feedback, you're practicing proactive compliance. This approach will dramatically improve revenue retention at your organization and help you avoid costly recovery losses down the road. Risk coding is critical to survival in the value-based world of healthcare. Reach out to me today, and together we can meet your risk coding challenges and make your collection system a center of revenue that will generate value for your organization for years to come.